That's how they get you. Here, let's try something. This one might end the great experiment right here. Let's see how this goes.
There are calls for an investigation into a multi-million-dollar federal program meant to help Canadians seriously and permanently injured by vaccines. The Vaccine Injury Support Program was created by the Liberal government during the pandemic to provide financial support to those who are hurt. But many who have turned to the program say they've been waiting for months, sometimes years, to get a response. Now, as Carolyn Jarvis reports, MPs are demanding an emergency meeting to get to the bottom of it.
Yeah, right.
Ridiculous. It's a slap in the face to every Canadian taxpayer.
The vice chair of the Federal Health Committee, Dan Mazur, is asking for an investigation into the Vaccine Injury Support Program. After Global News exposed allegations, the program is not providing the fair and timely access to financial help it promised.
People's lives are depending on this. This is an embarrassment.
Mazur and the 3 other Conservative MPs on the committee are requesting an emergency meeting. Mazur says the chair, Liberal Hedy Fry, has
emergency meeting.
Fry's staff told Global News she is away and unavailable. The Public Health Agency of Canada hired a private company called Oxaro to operate the Vaccine Injury Support Program. New data shows it has paid Oxaro more than $54 million to run the program since it launched in 2021. Only a third of that, $18 million, has reached the injured. $36 million went to administrative costs.
Can you
1,000.
Can you pause it for a sec before I lose my train of thought here? You know what? I was just gonna actually lambaste them for not going into these details, but this might be them going into the details. But I don't like how Global News is trying to take credit for this emergency meeting. It's because of our investigation. Like, if you were doing your job 2 or 3 years ago, then we wouldn't be in this situation, you jackass.
738 people are still waiting for their claim to be processed.
They have no clue what
just
they're
wait
doing.
too.
Laura,
do you remember doctors? Do you remember doctors got fired for putting in claims? Do you remember that they weren't allowed to put in claims? Do you remember how bad it was that even if doctors were ridiculed for even accepting that this was a possibility because they were all safe and effective? So how times that 1,700 by 100?
And that's just the people that they agree with.
This is infuriating.
Battling VISP for more than 3 years. She was diagnosed with Guillain-Barré syndrome following a flu vaccine, an extremely rare but documented side effect.
I thought this group would be actually, in my corner and advocating for me. Instead, I felt like I was an annoyance.
Her claim was denied, the medical board stating an infection was more likely to have caused the condition. She is appealing with the support of her doctor, who argues otherwise. Meantime, she's out more than $70,000.
So her doctor says it in the communist Canadian doctor system, and they're still like, nah, I think your doctor's wrong. I've never met you or talked to you really, but I think your doctor got this one wrong.
With no timeline for when her case may be decided.
Good.
The Guillain-Barré Syndrome Foundation says the program needs to be overhauled.
When a GBS patient finds themselves in the ICU, they need support, financial support and other supports within days or weeks, not months or years.
I think you've forgotten that there are people at the end of this line who have been damaged.
We again asked the Federal Health Minister, Marjorie Michel, for an interview, but her team declined, saying they're working on it, but wouldn't explain what that means. Meanwhile, Oxaro, the company which runs the program, says it has adapted to meet higher than expected volumes. As for the money...
What data? What forecast are you going with?
I mean, if you're paying out 2 to 1 into your company's pocket over what you're paying out, I'd be expanding too.
Yeah.
I mean, this is a thing. It could turn predatory on looking for vaccine injured people,
right,
which would be great for us. Arguably, I'm not saying anyone got injured by anything for the fucking YouTube and TikTok, please. But they're saying that. I'm just
I was just going to say, hang on before you finish that. The only reason, in my opinion, why this is happening is because X is finally allowing the injured to speak up because they were censored on Facebook, they were censored on Instagram, they were censored on X 2 years ago before Elon. And I'm not saying this is all about Elon, but something's allowing this change in narrative. And I see the injured on there all the time now on X.
Don't
They
say
finally
that.
have a voice.
You don't. You don't see nothing. You don't comment. But I mean, here's the thing. None of those other Canadian YouTubers want to touch this with a 10-foot pole. They won't talk about fentanyl, stuff like that. That's why, our little channel deserves some support once in a while. Like, subscribe, share, because we don't say weird words like
Dr. Uggs.
Yeah, or street candy. I got the street candy.
There's another F word that they're saying for the fentanyl too. I can't remember.
I don't think there's anything to finish up here.
It says its invoices are all approved by the Public Health Agency of
Oh,
Canada.
it's just so gross.
Donna?
Carolyn.
I didn't hear that last sentence again.
No.
It says its invoices are all approved by the. It has adapted higher than expected volumes. And as for the money, it says its invoices are all approved by the Public Health Agency of Canada.
2 to 1. 2 to 1. 2 to 1 to just give someone money. That's basically the program, right? You got to give them money. You got to decide, which shouldn't even be deciding. You shouldn't be deciding. You should just be listening to the doctor's note and then paying out money.
And maybe global news, maybe you should go to the OECD and the Canada's actual data on excess deaths from 2021 to 2023. Maybe even they're still going on. I mean, maybe you should do some research on that too. If we could hand you a bunch, like physically hand you a bunch of stuff to research.
Did they build a building? Do you think they built a building?
I don't know what you mean.
Well, what the 36 is $1 million is a lot of money in like a year or two, isn't it? In a year, was that a year or 18 months?
No, it's probably over the whole. That's over the whole program, I think.
Yeah, which is only what, 2 years?
I think it's been 3 years. Like 15 million. Wasn't it 15 million a year or something? Then it went up to 20 million a year. And
I think it didn't start till 23 though.
I don't know. It doesn't really matter. It's not a lot of money. That's the problem. It's not enough money at all. Even if it is not getting spent in the right way, that's nothing compared to what was being spent on big pharma and all the other stuff. It's nothing. It's peanuts.
No, it's not. Well, I know this is a problem. So you can't be stealing 2/3 of it.
Well, I mean, to me, it's just not enough. Even if they are stealing 2/3, like it's just nothing. 50 million is nothing. They're sending billions to all these other programs all over the place.
Well, that should
be here.
That doesn't mean you can't just ignore the small scale corruption just because there's bigger corruption. You got to fight all the corruption.